Okay, awesome. Wait, so you're a UW alum?
Oh, yes. I was actually saying before that I was undergrad and I did a master's degree in medical school all at the University of Wisconsin. So I had quite a bit of Madison time in my life, and I miss it.
Nice. Do you ever come back?
I have sometimes, not as much as I'd like to, and the campus has changed a lot too. I mean, the medical school is actually different from when I graduated, but it's still so beautiful. And my biggest dream in life is that my kids maybe could get to be Badgers someday too.
Oh my gosh, that would be great. Well, that's exciting. I love hearing, Badger connections. So, well, thank you for, doing this on the phone with me. I really appreciate it. I'm doing it from my home this morning.
Sure.
I guess the first question that I have is why did you decide to put this book together?
Sure. Well, infertility is actually a very common situation that affects a lot of couples. We think it's about 15% or 1 out of 6 couples that has difficulty getting pregnant at one point or another. So it may not be necessarily with your first pregnancy, it might be with a second or a third attempt to conceive. And for many people, it's a very private journey. So they don't often share with people in their family or even people that they're close to about the difficulty they have to get to getting pregnant. And if you look online, there's a lot of information that may or may not actually be true. So what we really wanted to do is put together a comprehensive book telling patients that they're not alone, that there are a lot of other considerations, and we wanted to also use the best evidence-based medicine to give them, patients the most practical and realistic advice possible.
Okay. Do you, in putting it together, did you find anything that might be new that we haven't heard before? I mean, anything specific? That's kind of a big, broad question, but
Sure. No, there's a lot of exciting advancements that are happening in our fertility field. So, but one thing sometimes patients are afraid of is if they seek fertility evaluation and treatment, that it's going to be very invasive and very expensive. So one of the things that we actually cover is that not all of the treatments that we have are difficult, and a lot of them are very cost effective. So one example would be thyroid dysfunction. So there's a lot of emerging information about if you have even a slight underfunctioning or overfunctioning thyroid gland, which is a gland in your neck, but it can affect a lot of processes in your body, including reproduction, that this might affect your ability to not only become pregnant or get pregnant. And the thyroid gland is a thing that's very easy to test, very easy to treat, and can have very satisfying results for a lot of patients.
wow, okay, that's very cool. What do we know about things like diet and exercise and being healthy when you're trying to get pregnant?
Well, sure. A healthy pregnancy actually starts even before you conceive. So we definitely recommend that for women prior to pregnancy, starting about 3 months ahead of time, they should take a prenatal vitamin with an adequate amount of folic acid in it. That's very important for a baby's brain development and development of the spinal cords and nervous system. And we also recommend that weight is actually a very important issue for both men and women. So being a normal weight is obviously the best, but if you're overweight, losing even a small amount of your total body weight, 5 to 10%, which for many people is 10 pounds or less, that can make a huge difference on your ability not only to conceive, but also to have a successful pregnancy.
Wow, that's very interesting. What about things like stress and caffeine? Everyone says that you need to be in a good place mentally, like not stressed out when you're trying to get pregnant. But that's so hard for a lot of people if they have like a stressful job or if they've got hard deadlines or whatever it may be. What can you tell people on how to de-stress? And of course, caffeine is an issue too.
I mean, stress is such a part of our modern lives, and actually having difficulty getting pregnant is another stressful factor that can significantly affect many of our patients. So we have tips in the book that talk about this. We definitely recommend modifying your stress level where possible. And so we talk about things like meditation or resiliency training, looking sort of to the bright side of things and focusing on the present moment. And we also talk about things that can be combination therapies that often go along with stress reduction, such as acupuncture for fertility.
Oh, wow. Okay. Speaking of acupuncture, but what are some other tools maybe out there to help you get pregnant or maybe help you determine when you're fertile? That might be another good question. So 2 questions. What are some good tools out there?
Sure. Well, there's a lot of people are surprised to find out that an egg is only able to be fertilized for less than 24 hours. So timing intercourse in order to become pregnant is actually fairly important. So one thing that we recommend in the book and that I really like is to use something called ovulation predictor kits. So they're available over the counter. You don't need a prescription. They're typically sold right next to pregnancy tests. But what these tests are actually detecting is a hormone that shows up in the urine one day before an egg is actually ready to be released. And so if for couples that are trying to become pregnant, the day that that kit is positive is actually probably the statistically the best day to have intercourse in order to become pregnant.
Okay. Do you recommend a specific ovulation kit?
Well, there's a lot of brands that are available. I've had patients that find a kit that works for them well from the dollar store, and I've had other people that buy more expensive tests and monitors. So my general advice is find the cheapest one that seems to work reliably for you.
Okay. What should people know about IUI and IVF? If someone's going through either one of those, what can they control, and what should they be asking doctors to help make sure that, they have a successful treatment that month?
Yeah, so the two treatments that you're talking about, intrauterine insemination or IUI and in vitro fertilization, are ones that are on the more aggressive spectrum of the things that we can offer. But I think if you're a patient, it's really important to ask the clinic or your provider what their success rates are. And sometimes understanding success rates for fertility treatment can be challenging because different clinics may accept different types of patients. So for example, one clinic may boast a really high success rate, but if you ask the right questions, you'll find out that maybe they steer couples that could be successful with less aggressive treatment straight to IVF, or maybe they don't accept couples that have more challenging fertility problems, such as an older female partner or somebody who's done IVF without success in the past. So I think one key tip is really finding out if the patients are at the clinic that you're attending are people that are really similar to you.
Okay. Does it always advance? Like, do people always start out with IUI and then advance to IVF? You kind of addressed that in the last question, but it seems like, you hear so many people having like 5 or 6 IUIs and then going to IVF.
Yeah, for many couples, in vitro fertilization really is kind of the last step treatment, so the most aggressive treatment that's the most successful. But our philosophy in our practice is that we really try to do something that's less aggressive and more cost effective if possible, because enough patients, if properly selected, can get pregnant with less aggressive treatments, and they may never need some of those procedures, such as in vitro fertilization. So we really try to tailor the right treatment based on a patient's individual circumstances.
Okay. Anything else that you can give us advice on for like any of those treatments? Is there like a number or something? I know everyone's different, but like, is there a certain number where you should say, okay, we can't do IUIs anymore, or we can't do IVFs anymore? Because I think a lot of women, when they go online and they read things, it's like, you have to stop after 5 IUIs. It's not going to be successful for you if you continue down that road. Or, just anything that you can give us information-wise on, like, is there an average or is there a time when you need to stop?
Yeah, and that is actually a very difficult conversation for many patients, deciding when enough is enough. And that's something that we cover in the book, too. But in general, what advice I typically give most patients is we typically try something for 3 or maybe 4 attempts. And if we're unsuccessful, we really need to sit down and say, is it time to consider moving on to the next step? Or do we really need to reevaluate our strategy altogether? Because a lot of the literature that's been done that looks on couples getting pregnant on their own, or even for fertility treatments, show that when it's going to work, it usually works within that window of the first 3 to 4 attempts.
I see. Okay. Is it all on women, or can men do something as well? You just mentioned diet and exercise for men, but what else can men do if there is a male partner? What can men do in terms of helping with fertility?
Oh, absolutely. I'm glad you asked that question, because we definitely see that in our particular patient population, at least 40% of the couples have a problem with some type of sperm function. So when we analyze sperm, we care not only about the count, but how well they're moving and also their shapes. So things that have been shown to improve sperm quality include not smoking. So that applies to men and women, but sperm and eggs are definitely affected by the products that are in tobacco, and that even includes smokeless tobacco. So recreational drugs are also detrimental, so we definitely recommend if couples use something like marijuana that they stop that. Exercise, so there are some studies that suggest that exercise for biking, for example, for more than 5 hours a week can be detrimental to sperm production as well.
Wow, interesting. Okay. My last question is, what do you hope people take away from the book the most?
Yes. One thing that I thought was really important to incorporate in the book, and which we did, is to put patient stories in. So sprinkled throughout the book, there are several stories of patients that can give other readers stories of not only hope but perseverance, and everyone in the story has gone through a different journey, and some couples weren't successful, and they'll talk about that as well. So I think there's really something for anybody on this particular path.
Okay. Anything that you want to add?
And another thing that we thought was very important to include in the book is to look at all types of couples that are coming to the clinic. So we're seeing an increasing number of LGBT couples, and that's something we definitely welcome, and they have unique family building considerations as well. We're also seeing a large population of people that maybe previously had cancer treatment and now are trying to conceive. So with improved cancer treatment, we have more cancer survivors, and we want to include them under the umbrella of all of our family building too.
Okay. Okay. Well, I'm set. Those were some great answers, and we really look forward to looking at the book all the way through. We kind of had a chance to skim it, but very exciting stuff there. So thank you very much.
Yeah, thanks for the opportunity.
Okay, thank you.